Welcome to Techstination. Joining us is Dr. Julie Morita, Executive Vice President of the Robert Wood Johnson Foundation. Thank you for joining us, Dr. Morita.
Thanks for having me, Fred.
There's a new survey out that you took part in here called The Impact of Coronavirus on Households with Children. Give us a little overview, first of all, about the survey and how it was conducted, why it was conducted.
The survey is a survey that includes 5 different segments, and this segment looks at the national results. So it was a survey of 3,400 households throughout the United States, looking at what the economic impact was on households within the United States as a result of COVID.
And some of the key findings?
What's of interest is that despite the billions of dollars that we have spent, the government has spent, the survey shows that our response to the pandemic has really failed too many people, with the most severe economic and health impacts really concentrated on Black and Indigenous and people of color, and then those living in low-income populations as well.
Let's talk some specifics of what you found. One of the areas that you looked at had to do with internet access and the lack thereof, I suppose, in many households.
The survey found that internet connectivity issues are broader than we realize. As someone who's been working from home for the past 7 months, and my kids have actually been doing homeschooling, I know how dependent families are on the internet to be able to get their work done, to make their livings, and also for the kids to be educated. What our survey found is that nationally, about 3 in 10 households reported having problems with their internet connections. But what's worse is actually 1 in 3 households with children reported having serious problems with their internet that interfered with the kids getting their schoolwork done or the parents getting their work done. And then when we look at it across like larger urban areas, we can see that in places like New York, LA, Chicago, and Houston, more than 40% of the households with children actually struggled to have internet connection.
So that would mean even when school districts are providing things like Chromebooks and things, which some are to students, that doesn't mean they can get online.
No, I think what we're seeing with the pandemic in terms of who's actually getting sick, who's getting hospitalized, and who's dying, it's disproportionately impacting those households, those communities that have historically struggled in the past and who have been failed by our policies. So people, lower income communities of color have really been hit hardest. And so from an internet connection perspective, it's the same groups that are being hit hard. And then that just sets them back further in terms of not being able to keep up with their peers in terms of education, and that's a problem.
So the question is, what could be done? What changes could be made by policymakers?
So there are, policies that are in place right now that have been put in place to actually help people through the pandemic. And our results from our survey actually came while people were receiving those supports. What we need is for policymakers to really continue to support our families, because when those supports like protection from eviction and mortgage foreclosures or unemployment insurance, those things aren't in place right now. And if people were struggling as much as we're reporting now when those protections were in place, we know it's only going to get worse. So we really need policymakers and decision makers to really step up and provide some of these supports so people do have housing to live in, stable housing, that they have money to actually support food, paying their bills, having access to the internet. All these basic services are what we really are in need of, and it's a lot of people in the country who are really struggling right now.
I've heard it said by some on the topic of telemedicine, which is a little different here, that internet access, if you view healthcare as being a right of sorts, then internet access should be too. Any thoughts about that?
Sure. What we've seen throughout the pandemic is that people were reluctant to seek mental health care services because they were afraid of being exposed to COVID. I saw that with my parents who were reluctant to get eye visits or to have their basic health care checks because they were worried about getting COVID. telemedicine became a great alternative. So physicians could provide healthcare services via the internet, via video conferencing, so that patients didn't have to go in and potentially be exposed to COVID. So without access to a strong internet connection or a reliable internet connection, people don't have access to educational opportunities, but healthcare services as well. And these are critical supports that people need to exist healthy and to have good well-being.
Are you hoping that this survey that you're out with will have some kind of impact in Washington, which is, I guess, where there's been a logjam?
The point of doing this survey is really to understand what our nation is experiencing during this COVID pandemic. And the data that we have found and have what they have revealed is really that our communities are really struggling, particularly communities of color, low-income communities as well. And these are the communities that we have failed to support in the past. And what we need is for our decision makers and our policy makers at the federal, state, and local levels really to acknowledge these folks who are struggling and change their policies and change their structures and systems so people have stable jobs, stable housing, good income supports, education, and food security. So that is the point of this survey, is really to lift up what people are experiencing and to really motivate our policymakers to do the right thing.
Is there a place people can go to for more information about this survey?
The survey is, again, like I said, is one of a 5-part series, and the results from the survey are available on the Robert Wood Johnson Foundation website. So people can go to rwjf.org and see the results of all the surveys.
Dr. Julie Morita, thank you so much for taking the time with us.
Thank you for having me.
Now this. It takes a lot of listening to build a better radio, and that's just what the folks at C. Crane have done. Bob Crane and his crew, nestled among the rivers and tallest trees in the world in Fortuna, California, have made a habit of listening to their customers. And that's just what they've done in building the CC Skywave SSB, the Swiss Army knife of portable radios. For everyday listening to AM or FM in the yard or patio or on the nightstand without having to drain a mobile phone battery, it's a great companion. But it is also a companion equipped for NOAA weather information and alerts that can be life-saving. You can listen to FEMA and Coast Guard transmissions too. Beyond all of that, you can tune into shortwave signals from around the world. It's compact, easy to take with you, and built to last. The CC Skywave SSB. Click on the link at Techstination.com.